I would request everyone to please be seated. Good afternoon, all of you. I hope you all had a refreshing and delicious lunch. It's wonderful to see you all back, energized and ready to dive into the next session of our conference. We have an exciting lineup for the afternoon, so let's get started without any further ado. It gives me an immense pleasure to invite our next speaker, Dr. Anand Dharaskar, sir, who will be talking on the topic Enlarged Prostate, Presentations and Minimal Invasive Approach. And to conduct this session, I would like to invite the chairperson, Dr. H.G. Umraskar, sir, General and Laparoscopic Surgeon, who is an Assistant Professor and Head of the Unit of Surgery at BJ Medical College and Sassoon Hospital with an experience of 25 years. We welcome you, sir. And we have Dr. Sagar Bhalerao, sir, who will be joining us shortly. He is a laparoscopic and robotic neurosurgeon, expert in laser kidney transplant andrology. He is attached to all major hospitals. Sir, please introduce our speaker. Can we have Dr. Anand Dharaskar, sir? We welcome you, sir.
Good afternoon all. I understand it is a post-lunch session. It is difficult to digest the lecture. It is easy to digest the food, I can understand. But still we have to go ahead with the session as the timing is running. So I am going to start a urology session here. So I have got Dr. Anand Dharaskar, who is a urologist and kidney transplant surgeon. He is MCH from SGPGI Lucknow, ranked one of the best urology institute of the world. He is practicing since last 22 years at various cities in India like Nagpur, Mumbai, Bhopal, Lucknow, and he is in Pune since last 14 years. His keen interests are in kidney transplant, HOLEP, Resium for BP hydroneurology, and stone like supine PCNL and RISS laparoscopic urology. So he is an advanced laparoscopic as well as the urology surgeon. Over to you, Dr. Anand.
Thank you for kind introduction. Good afternoon, everyone. So this is a postprandial session, like what we have physiology lectures in MBBS. Okay, but today we'll make it little interesting, and I'm not going to take you into the theory part of it. My topic is the enlarged prostate. So half of the population sitting here is carrying prostate. So everyone is not a patient. Okay, literally like you can say gender wise, so 50-50. So every male with prostate is not my patient. So let's see when you call a patient with a prostate. The first thing, how a urologist deal with the organs is this is a lower urinary tract. So prostate is a small walnut-shaped gland just below the bladder. Okay, it is there since birth, and as the age increases, the size of the prostate keep on changing. So what do you mean by enlarged prostate? So by definition, you will see somebody having a sonography report in your OPD. सर माझा प्रोस्टेट वाढला आहे आणि मला माझ्या रिलेटिव्हनी सांगितलं की तुम्ही ऑपरेशन करून घ्या किंवा कॅन्सर तर नाही आहे किंवा सो मेनी त्यांचं जे फिअर किंवा बायस असतील त्याप्रमाणे पेशंट विल कम टू यू. बट व्हॉट डू यू मीन बाय एनलार्ज प्रोस्टेट? द एक्झॅक्टली साईज ऑफ द प्रोस्टेट इज मोर दॅन नॉर्मल. व्हॉट इज नॉर्मल देन? अराउंड 30 to 40 grams of prostate is considered to be a normal prostate. So how the percentage of enlarged prostate increases? So if you consider 80-year patient, there is a chances of enlarged prostate in 80% of cases. And nowadays it is very common to see a geriatric population sitting in your OPD. I know during MBBS MS days 60 was considered की ठीक आहे बाबाला सांगा पुढच्या महिन्यात अपॉइंटमेंट देऊ, पुढच्या महिन्यात काही बाबा मेडिकल कॉलेजला यायचे नाही. ठीक आहे. सो दॅट वॉज अवर आर्ग्युमेंट की 60+ इज okay. But nowadays I have operated a 94-year male with prostate, and after that 4 years he was okay and then he had paralysis, but 94 is still not a bar for any surgery. This organ is very deep seated in the pelvis, so diagnosing the element of prostate itself is a mystery. If you go back to the history, Raja Maharaja royal family will always have this kind of a suffering, and the Vaidya or the person who used to treat the prostate was supposed to be a blue-eyed boy in the view of that king and all that. So it is a very delicate and deep-seated organ, but it is very functional and very important. It is very close to the sphincter. So if you do something wrong with the prostate, patient will always curse you and he will roam around the entire city and make you absolutely a bad day. And there are a lot of nerves around the prostate which are erectile functioning nerves. So the ramification of prostate is multifocal. So if you are a good prostate surgeon, you're bound to sit with the who's who of the city and that particular area, because every executive or a top rated person is bound to have this kind of prostate related issues. So what is the cause? Like when you say the prostate is enlarged, what is the reason behind it? Let it be physiological, aging, which is the most common, and that is the most important reason. But there is no what you call remedy for it. Everybody is going to be 60 or 80 one day, and every urologist will be a patient one day. So aging is important factor. As I said, 60 years will have a 60%, then later on 70, 80 or so on. Another important reason is infection. So what do you mean by UTI? UTI is like a basket term for a urologist, from kidney to ureter, bladder, prostate. So prostatic infection is called prostatitis. So it's a very typical picture. You will get an executive of around 30-40, those who is under stress, trying to meet the deadline. And if you say something about urinary symptom, first thing you should keep in your mind is that he has a prostatitis. Then another is malignancy. Prostate cancer, if I tell you, it is one of the commonest male malignancy worldwide. And in India, we generally diagnose them very late, once it is advanced, locally advanced or metastatic. Sometimes it happens that there is a radiation to the pelvis for some other reasons, and patient will come to you with urinary symptom. But see, prostate is enlarged and the problem lies with the bladder. So it is like a traffic jam. आपल्या गणराज चौकात जर ट्रॅफिक जमले तर शेवटचा माणसाला जो त्रास होतो तो ब्लॅडरला होतो इथे. सो प्रॉब्लेम इज विथ द प्रोस्टेट अँड द सिम्पटम्स आर विथ द ब्लॅडर. So this is the gland. You can see the gland is grown laterally. It has grown inside the urethra and it is also growing into the urinary bladder. So if there is an enlarged prostate, is it a diagnosis? It is absolutely not a diagnosis. It is probably at the most you can call it a sign, because पेशंटला तर सिम्पटम नाही आहेत. सोनोलॉजिस्टला त्रास आहे, त्यांच्या घरच्यांना त्रास आहे, पण पेशंटला सिम्पटम नाही आहेत. So what exactly is the symptoms of enlarged prostate? Mostly they are asymptomatic. The gland is 50, but if you ask the question, there is nothing with the patient. LUTS, lower urinary tract syndrome. This is a very common term with all the urologists. If you talk on phone, नाही सर त्याला significant LUTS होतं आहे म्हणून मी त्याचं TRP केलं. So this is LUTS, lower urinary tract symptoms. We'll come to it later on. Then there is the UTI. Any male having a recurrent UTI of particular age group, one has to always suspect whether it's a complicated UTI. And one of the reasons for complicated UTI is a enlargement of prostate. If there is no reason for UTI, it is called as a simple UTI. Sometimes patient present with hematuria, and nowadays we are thankful to our cardiologists, means all over India, they are giving a lot of anticoagulants for the reasons you better know than me, that ACS, and because of that there is a tremendous epidemic of hematuria in those patients where the prostate is already a problem. So it is important to identify asymptomatic prostate also. There can be a residual urine in the bladder. So sonography report showing more than 50 cc of residual urine is always something to act upon, and below that less than 50, and that too happening repeatedly, then you just ignore it. Patients sometimes land up only in retention of urine. Sagar, please come on the stage.
Welcome, Dr. Sagar Bhalerao.
So retention of urine is one of the important, what you call endpoint or a landmark in the lower urinary tract symptom journey. It is a dead end. After that, there can be obstructive uropathy. So as I said, urinary tract can be upper and lower. So prostate problem can lead to a upper kidney problems or a renal failure. CKD and renal injuries are the occasional collateral damage. So once the patient comes with the enlarged prostate and he says there is a symptom, what is the most important thing? As Dr. Prasad Bivre has said in the morning, history, and then lastly the physical examination. History is very important, and mind my words, taking a history from oldies is absolutely a difficult task. Half of the time they don't understand what we are talking about. त्यांचं ऐकण्याची लेवल वेगळी आहे, त्यांचा इंटरेस्ट वेगळा आहे. सोबत जर कोणी फिमेल असेल तर ते अर्ध्या गोष्टी तुम्हाला सांगणार नाहीत, तर दुसऱ्या विजिटमध्ये तुम्हाला ते सगळ्या गोष्टी हळूहळू सांगायला सुरुवात करतील. आणि मोस्टली सगळे ओल्डीजना डिनायल फेजमध्ये आहेत. दॅट इज माय पर्सनल ऑब्झर्वेशन. कोणाला विचारलं की युरिन कशी होते, छान, मला काहीच प्रॉब्लेम नाही, मी रोज 5 किलोमीटर चालतो, 2 लिटर पाणी पितो, सकाळी हे पितो आणि मी सगळ्या ॲक्टिव्हिटी करतो. मग नेक्स्ट प्रश्न, तुम्ही रात्री किती वेळा उठता? तर मी 4 वेळा उठतो. म्हणजे त्यांना 4 वेळा उठणं हे ॲब्सोल्युटली नॉर्मल वाटतं. बाय डेफिनेशन मोर दॅन 1 नॉक्टुरिया इज कॉल्ड ॲज ए ॲबनॉर्मल ऑर पॅथॉलॉजिकल. सो यू हॅव टू आयडेंटिफाय ओल्ड एज. आणि प्रत्येकाच्या घरामध्ये एक पेशंट आहे. तुम्ही त्यांना ऑब्जेक्टिव्ह प्रश्न विचारा ते IPSS स्कोअरचे, त्यातले अर्धे उत्तर ते पॉझिटिव्हली देतात की ते सिम्पटम्स आहेत. पण अदरवाईज त्यांना विचारा युरिनचा काही त्रास आहे, जनरल आन्सर इज नो. आणि त्यांनी ठरवलेलं आहे, त्याच्यामागे पण एक सायकॉलॉजी आहे. त्यांच्या काकांचं आजोबांचं युरिनरी बॅग घेऊन त्यांनी महिनाभर त्रास सहन केलेला आहे किंवा इन्कॉन्टिनन्स झालेला आहे, डायपर्स वापरत आहे. फॉर युअर इन्फॉर्मेशन, जापान इज युझिंग मोर ॲडल्ट डायपर दॅन द पिडॅटिक डायपर. सो दिस इज हाऊ दी डायपर्स आर यूज कॉमनली. आणि त्या कारणाने सरळ सोट आपले पेशंट सांगतात की मला युरिनचा त्रासच नाही आहे. आणि जी गोळी लागते ती तर सकाळी आपला मॉर्निंग वॉकचा मित्र देतोच, ती संध्याकाळी घ्यायची आणि आपलं काम चालू ठेवायचं. सो मोस्ट ऑफ द ओल्ड इज आर इन डिनायल. So other test is urine test, very common. But what you have to see whether there is RBCs, pus cells. Reading, you everybody knows about it. PSA, one suggestion is here: do not do PSA just for sake of doing it. If you have a strong suspicion, family member has cancer, or rectal examination is showing any problem, then only go for it. Otherwise, PSA lead to promoter of stress and anxiety. बिकॉज पेशंटला मग रात्री झोप येत नाही की मला कॅन्सर झाला आहे. आत्ता तर एक रिपोर्ट आलेला आहे, मग आपण बायोप्सी करणार, टेस्ट करणार, पण त्यांचे ते 8-10 दिवस फॉर हॉरिबल जातात. सो अनलेस यू नो एनिथिंग अबाउट PSA किंवा इंडिकेशन असेल तरच PSA करावं. क्रिएटिनिन अँड सोनोग्राफी विच आर द ॲब्सोल्यूट टेस्ट फॉर एनीवन वेअर द प्रोस्टेट इज सस्पिशियस. सो व्हॉट इज द कॉमनेस्ट सिम्पटम्स ऑफ प्रोस्टेट? शेवटच्या लाईनमध्ये लिहिलं आहे FUNIISS. दॅट इज अवर ॲक्रोनिम ऑर अ शॉर्टकट. सो फर्स्ट इज फ्रिक्वेन्सी. जर पेशंटला वाटलं की नेहमी मला युरिन येते आणि इट इज हॅम्परिंग माय सोशल लाईफ ऑल्सो आणि इट इज हॅपनिंग मोर दॅन हाफ, मग त्याला एक पॉईंट देतो आपण. अशा प्रकारे तो स्कोअर करत IPSS स्कोअर तयार होतो. फॉर नॉक्ट्रिया मोर दॅन 1 इज ॲबनॉर्मल. सो 4 वेळा जर कोणी जात असेल तर त्याला 4 स्कोअर असतो. अर्जन्सी, सो अर्जन्सी इज सच अ हार्मफुल थिंग्स. अर्जन्सी कॅन लीड टू मेनी सोशल अँड डोमेस्टिक साईड इफेक्ट लाईक फॉल. सो अर्जन्सी, इनॅबिलिटी टू कंट्रोल द युरिनेशन, आणि हे प्रिसाइजली आपल्याला लक्षात राहते. रेसिड्युअल युरिन, सेन्सेशन दॅट इनकम्प्लीट वॉइडिंग इज हॅपनिंग, आणि युरिन फ्लोचे 2 म्हणजे डिक्रीज इन द फ्लो अँड स्ट्रेनिंग. सो ऑब्जेक्टिव्हली इफ यू हॅव टू आस्क एनी वन इन युअर फॅमिली, यू विल ऑलवेज फाईंड की कुठेतरी हे सगळे सिम्पटम्स सगळ्या लोकांना आहेत. अँड देन अकॉर्डिंग टू द नंबर्स अँड दी स्कोअर त्याला आपण लो, मॉडरेट, सिव्हिअरमध्ये डिवाईड करू शकतो. सो वाय इट इज इम्पॉर्टंट टू कंट्रोल द युरिनरी सिम्पटम्स? सो युरिनरी सिम्पटम्स इज लिंक टू अवर सोशल वेलबिंग. त्यावेळेस लहान मुलगा घरून शाळेत जातो ना, त्याला सगळ्यात पहिले एकच टेन्शन असतं की मला युरिन आल्यावर मी काय करणार. सो अँड द लर्निंग ऑफ कंट्रोलिंग द युरिनेशन इज मोर इम्पॉर्टंट इफ यू आर गोईंग आउट ऑफ युअर हाऊस. तुम्ही घरातच राहिलात 10 वर्ष सुरुवातीच्या आयुष्याचे, तर प्रोबॅबली तुमचं युरिनरी कंट्रोल मे नॉट बी ॲज गुड ॲज दॅट. सो सेम थिंग रिफ्लेक्ट इन युअर ओल्ड एज. इफ युअर युरिनरी कंट्रोल इज पुअर, युअर सोशल लाईफ इज 100% गोइंग टू बी अफेक्टेड. How it is going to affected? I know n number of my patients that they have stopped doing morning walks because there is a frequency of urine. आणि तेच पियर प्रेशरच्या लहान मुलांना असतं ना, ते म्हातारा माणसांना असतं की माझा मित्र म्हणाला, अरे तू तर तसा फार फिट आहे, पण काय बाणेरवरनं पुढच्या चौकात जाईपर्यंत तू 2दा बाथरूम शोधतो. सो दॅट इज देअर इन माइंड. अँड कॉन्फिडन्स इज व्हेरी इम्पॉर्टंट. या वयातल्या लोकांना दुसरं काहीही काम नाही आहे. दे आर सो मच ऑफ टाईम विथ देम. दे शूड स्पेंड इट क्वालिटिवली. So that quality will only come with the confidence. As I said, nocturnal urgency and frequency is leading to cause of fall. कारण की प्रेशर त्यांना हे नाही की कपडे ओले होईल. कपडे ओले झाल्यावर उद्या सून मला काहीतरी म्हणेल, मुलगा म्हणेल बाबा तुम्हाला कंट्रोल करता येत नाही. सो दॅट सोशल प्रेशर इज इमेन्स विथ द ओल्डीज. सो दे डोंट वॉन्ट टू वेट देअर गार्मेंट्स. आय नो एन नंबर ऑफ पेशंट्स की ते माझ्या उपडीत येताना डायपर घालतात. त्यांना हा प्रश्न विचारावा लागतो की तुम्ही रोज घालता का? नाही, आज मी हॉस्पिटलला आलो ना म्हणून घातला आहे, की मला भीती वाटते की रस्त्यात काही झालं तर मग सगळ्यांना कळेल किंवा त्रास होईल. पुअर एक्झरसाइज टॉलरन्स. इफ यू आर लीकिंग फ्रॉम बिलो, हाऊ कॅन यू डू एनी स्क्वॉट, सूर्यनमस्कार किंवा इवन वॉकिंग? सो युअर एक्झरसाइज टॉलरन्स विल बी लेस. सो देन what Dr. Badani has told you, how you are going to implement that low lipid profile, for that matter exercises, you can't do your day-to-day activity. And Dr. Bhate will also agree with me, if a patient has lower urinary symptoms, he bound to have a constipation. They are linked together. If the one aspect of this movement is done, like bowel movement is good, your urinary problem will be solved. If urine movement is good, your bowel problem is solved. And these patients are less likely to travel. So if you calculate this, there is no way to calculate, but if you ask a particular patient, it is very important to treat. They are special kind of investigation, and mind me, it is a headache of urologist who is going to treat whether to do it or no. But your aspect is there is another way of treating the prostate is that you can do a transrectal ultrasound. There is a number of interventions we can do through that route. But best thing is get the prostate examined yourself above 40, 50 or your family members by a urologist or a general surgeon. This is the test. This is the hallmark of our today's presentation. If there is enlarged prostate, please go for finger test. This is also called as a rectal examination, or in urologist term, digital rectal examination. But this is not something like a digital, digital means with the finger. And this is a rectal examination. And this can be done in various positions. And if you start doing it now, initially you will have that hiccup area. Why should I wear a glove? I have seen many physicians, or for that matter urologists, they don't prefer to wear glove in the OPD. Because you have to wear the glove, then after that you have to wash your hand. In between you have to expose the patient, do the test. Mind it, it's a cumbersome test, but the rewards we will get because of this test is immense. So always go for a physical examination by finger, that is called rectal examination, in all symptomatic patients or those where the prostate is enlarged. And this is office urology now. Everybody will love to do this test because there is no glove, there is no cumbersome, no hand washing. Only thing you require to do is to advise a uroflowmetry. This is available, and in Manipal it is available in our OPD next to the room. Only thing you have to do is ask the patient to drink a lot of water and go half full bladder. If the bladder is quite full, he will void in front of Manipalan, but he will not do flow in my OPD. So general advice is to go with half bladder, go to the clinic or a place where the uroflow is done, wait for 10-15 minutes and do the test. This is the classical, the upper left one is the classical bell-shaped curve, which is a normal uroflow. You consider an open bottle, like you have 1 liter bottle, the cap is open. Moment you just invert it, within no time half of the water goes out. And after that, at the end, the flow is also going down. So this bell-shaped curve is a standard uroflow. If somebody is having this type of a test, his DR is normal, then he should forget prostate for his life. Or for that matter, momentarily for next 5-10 years. But then obstruction you can very well see. The different patterns. There is objectivity here also, the maximum flow, average flow, everything. But at least advise this test. One is urine routine examination, one is rectal examination, and this uroflow. This is endoscopy, but this endoscopy is not the one we are doing in OT. This is a flexible endoscopy. It is done in the OPD, and it is quite diagnostic because you can see the organs from inside. Like you can see whether there are stones, stricture in the urethra, how big is the prostate, is there any tumor in the bladder, or what is the reason of hematuria. So this is the flexible endoscopy, which is like a walk-in, walk-out job. But once the diagnosis is done, that patient has BPH and symptoms, what is important? The first and foremost is lifestyle. Because there are so many, as I said, the water intake of the patient may not be adequate. He is drinking just before going to bed. So he is not naturally going to have nocturia. Weight control has to be there. So as Dr. Bivre given the general assessment, in that assessment you can find out that patient needs some kind of a lifestyle changes. Water intake, this is the commonest question. I think half of the population must have witnessed. Patient विचारतो की पाणी किती प्यायचं. आता आपण आयुष्यात किती वेळा पाणी, आज किती लोकांनी पाणी मोजलं? कोणी पण पाणी मोजलं असेल मला आज इथे वाटत नाही. आणि इथे 50+ 60+ पण पॉप्युलेशन आज आपल्या समोर आहे. पण पाणी मोजणं हा आपला कन्सेप्टच नाही आहे. पाणी मोजण्यासाठी जर आपल्याला गरज असती तर लहानपणीपासून आईने आपल्याला 100 ml बॉटल दिली असती आणि आपण 5-10 वेळा मोजली असती. पाणी मोजायची आयुष्यात बिलकुल गरज नाही आहे. व्हॉट यू शुड डू, यू शुड रिस्पेक्ट युअर बॉडी अँड प्लीज लिसन टू युअर ओन बॉडी. जर तहान लागली तर पाणी प्यायचं. आज पाणी जास्त प्यावं लागेल, पण हे 15 दिवसा अगोदर जे वातावरण पुण्यात होतं, मला वाटत नव्हतं की पाण्याची आज गरज पण लागली असती आपल्याला. सो पेशंटला पण हे सांगा, डू नॉट कॅल्क्युलेट वॉटर, जस्ट लिसन टू युअर बॉडी. तहान असेल तर पाणी प्या. खूप सारे ओल्डीज तर पाणी याच्यासाठी पितात की जेणेकरून डॉक्टरांकडे जावं नाही लागेल. अँड देअर लॉजिक आय डोंट नो, अँड दॅट इज द एक्झॅक्टली रिझन की आम्हाला 20-30% जास्त पेशंट येतात. कारण यांनाच लोअर युरिनरी सिम्पटम्स आहेत, यांनाच अर्जन्सी होते, यांनाच नॉक्टुरिया होतो, आणि हेच लोक आपल्याकडे जास्त सिम्पटम घेऊन येतात. सो पाण्याचा प्रश्न तुम्ही मिटवला पाहिजे, जो पेशंटसाठी इम्पॉर्टंट आहे. स्लीप, हाऊ द स्लीप इज रिलेटेड टू प्रोस्टेट. एव्हरीथिंग, इट इज अ लिस्ट अंडरस्टूड सायन्स, दॅट इज द स्लीप. बट इफ यू टॉक टू द पेशंट ज्यांची स्लीप पुअर आहे, दे आर मोर लायकली टू गेट युरिनरी सिम्पटम्स इन द नाईट. Then sleep proper high, fixed timing of going to bed and waking up, and sound sleep will less likely to have a BPH related problem. So remedy is oral medication. Oral medication, you know the drugs. There are at least 4 or 5 drugs. But problem with the drugs is that patient are very afraid of the surgical part, so they generally choose the drug. And there are complications of the drug. So we'll move a little fast here. So if the medicines are not working, what is the next level you do is the surgery. You know open surgery is absolutely gone. I have not done a single open prostate in last 15 years. So endoscopy is the only way to go ahead, because there is no cut, no stitch, and everything happens within a 2-day span. What are the options? TRP, everybody is aware of it. Today we'll talk about only 2 options. One is laser, that is HoLEP surgery, and the new coming thing is called resume water vapor surgery. I will finish in within next 2 or 3 minutes. So this is the endoscopic route. So you put anything into the bladder, it goes through the urethra. But earlier technique like a HoLEP required 26 number of tube. So you just imagine whatever is a French or centimeter, but 26 is a bigger tube. Newer technique will go with 16. So that is the first advantage of going with the newer technique. So how the HoLEP happens? You just imagine that prostate is nothing but an orange. So you keep the peel and remove the entire pulp of the orange. So instead of using a knife, you put a laser inside and keep the skin of the orange there and remove the pulp out of it. So you can imagine the lower down 3 figures, the prostate is getting empty lobe by lobe. And this is how the laser looks inside. Laser is a specialized light and the prostate is a soft tissue. Laser cuts and the prostate is then removed through the, this is the end picture. So these are the multiple chips which are sent for examination, and urine is clear. So we can do with antiplatelets also. But there is a definite chance of bleeding in this technique. And minded, it is very difficult to learn HoLEP. Even in Pune, we can find that very few people are taking up laser HoLEP surgery in last like 15 years or so. So after that, what you achieve is a good flow, less residual urine, less complications. So what is the alternative now? One is medicine, one is HoLEP. Third is called minimal invasive surgical therapy. What is the role? Why you need minimal invasive? Initially, HoLEP is also minimal invasive because maximal invasive is open job. But the advantage of this technique is that it is done with a smaller catheter. So there is a less injury to the urethra. It is a very short duration procedure. Instead of 1.5 hours or 1 hour, here it is a 10-minute job. It can be done in a daycare. Like the way we are talking, morning patient will come, operate, and by the time we are finishing our CME, most of them will leave the hospital. There is minimal catheterization time. Size of the catheter is also less, so it is very comfortable to the patient. And short OT. Everybody loves to finish surgery in short period of time. Worldwide, the trend of surgeon is not to do a supramajor and long duration surgery, but to go for a effective and a short duration surgery. So this is the pre-operative uroflow of one resume patient. You can see the maximum flow here is only 12. So flow is, we want 15 and above flow, so the flow here is less. Once the resume is done, this was the after 2 months uroflow of the patient. And resume, I will give a short 2 slides introduction to the resume and then we'll conclude. So this is the way patient get the benefit of improved urinary flow with minimal complications. This is the resume machine, and I am thankful to Manipal to have the machine in the first go, because this is the first, Baner is the first place where the resume is conducted in an entire 38 Manipal chain. And this is a very portable small machine, and it is done under a short general anesthesia. It takes only 10-15 minutes, and it is covered under insurance also. And there is no need to stop any antiplatelets. For that matter, even anticoagulants like rivaroxaban, epoxaban, even warfarin, all kinds of drugs can be managed, and it is easy. Only thing, you have to keep catheter for 4 or 5 days. See, there is a trade-off. You will never get a win-win situation, and there will be zero what you call complication or a payoff. The only thing is that you have to keep catheter for 4 or 5 days, and later on the results are fine. So this is all about enlarged prostate and the minimal invasive approach for that. Thank you. Yes, sir.
Very thank you for an lucid presentation, which is so easily understandable to everybody here. Now, sir today told newest technology called Resume. it is said to be the breakthrough. Now, initially, TURP was the gold standard, but due to lasers, that even these standards is fast changing. And the problem with this older TURP and laser is that it causes urethral stricture in some patients. And it is called as a once a stricture is always a stricture. And patient has to do dilatation or has to undergo another operation called urethroplasty. Eurocool Hospital is doing thousands of urethroplasty. So
Today also
Dharaskar
they
sir
are
is here.
conducting one workshop for
Dharaskar
sales.
sir is here with his new resume, and he will ensure that there will be no stricture and the prostate will be all treated.
Correct. That is the future of prostate is urethra free. That is the sentence by Dr. Kulkarni, that do not touch anybody's urethra for the sake of prostate.
Thank you, Dr. Anand. You have presented the topic very completely in a very simplified and practical manner. Thank you very much.
Thank you very much.
Thank you, sir, for a wonderful session. I would request the chairperson, Dr. Sagar Bhalerao, sir, and Dr. H.G. Umraskar, sir. So please felicitate our speaker, Dr. Anand Dharaskar, sir. A huge round of applause for the speaker, please. Thank you, sir. I would request Dr. Prashant Kulkarni, sir, Senior Family Physician, Pashan, to please felicitate our chairpersons. Dr. H.G. Umraskar, sir. And Dr. Sagar Bhalerao, sir. Thank you, sir. Our next speaker